Good morning and thank you very much for joining us. I am Yori Folarin. We thank God it is Friday. We also thanked him it was Monday right through till Thursday, and here we are on Friday. I'm alongside my colleague Asukwa James, TVC News Assignment Editor.
Yeah, good morning.
Indeed, good morning. Today we're going to be looking at the heroic and monumental work that our health workers are doing, on the field out there in these COVID-19 times, and perhaps the challenges, or let's just say the word dangers, that they confront on a daily basis on our behalf. That's going to be our focus today, and we shall be speaking with, a doctor from the Lagos State NMA, Nigerian Medical Association, and we'll also be talking with a public health expert, Dr. Amadele Boyo. But before that, let's do a roundup, if you want, and look at the PTF briefing. The latest is from yesterday that we can broadcast to you.
Compliance with the guideline measures for easing the lockdown has not been too impressive, as the Presidential Task Force continue to worry over actions and inaction of citizens that will likely undermine the national response plan against COVID-19. Another problem that seem to have found a solution is the security of the isolation centers and management of patients with confirmed cases of COVID-19. The situation in the Northeast and the reported strange deaths in Yobe State is another headache for the task force.
If one of the key protocol is social or physical distancing, how do you operate that if you allow the use of motorcycles? It's totally impossible.
We are investigating reports from Yobe, and we are monitoring developments with regards to the isolation center in Gombe. The PTF will continue to provide the needed sensitization within the Northeast, including providing necessary human, material, and technical support required to control the spread of the virus.
Health authorities now say there is an urgent need to train many more frontline health workers to manage the rise in COVID-positive cases.
We do not have the latitude of having so many health workers in treatment or in isolation and being out of service in these critical times. But I also take the opportunity to again appeal to all healthcare professionals and associated personnel to diligently follow safety, infection prevention and control protocols.
The DG of the NCDC says small and medium-scale businesses who are the worst hit should also put in place measures to stop the spread of the virus within their workspace.
To really urge every business to be sympathetic, sensitive and empathetic towards their employers through this very difficult time. We're all facing very challenging times. All of us sitting here, even those of us in the PTF, we all have ministries or parastatals to run. As much as we're working on the outbreak, we also have our own staff to keep motivated, to keep them working. So really encourage all business owners, all leaders of teams, all managers of people to keep encouraging their staff to stay physically and mentally healthy through this difficult time.
The task force insists if the guideline measures are not followed, the modest gains from the 5 weeks lockdown will be completely eroded. Femi Akonde, TVC News, Abuja.
Indeed, as always, our thanks to Femi, and reports went out earlier. As I said, I've given our focus today. It's going to be on health workers. They are the real heroes and heroines in all of this. They're actually on the front line.
Exactly.
When we use words like front line, you think of a war, a struggle, and indeed that is what COVID-19 is. Again, give a bit more scope to it before we come to listen to our contributors today. Our Helen Osamide Akins also has a report.
Since the coronavirus outbreak in Nigeria in February 2020, health workers have been at the forefront of responding to and treating affected persons. This has increasingly exposed them to the danger of getting infected while they cope with the dangerous virus in a country of about 200 million people. They also have to operate in a healthcare system that is overstretched and lacks necessary equipment. It is not surprising that in such circumstances, many health workers have been hit by the virus.
I applaud all our health workers in the front lines of COVID-19 pandemic, and the government will continue to provide you with the necessary personal protective equipment. I urge you all to take the necessary precautions for your own safety. Please do not try to treat patients without using adequate PPE.
The task force also disclosed that about 10,000 samples have been tested since the index case was detected in Nigeria.
Kano was unlike Lagos that had a gradual increase in cases. The cases really increased rapidly in Kano. So suddenly they were faced with a situation, you have 20 cases today, you're trying to bring them in, the next day you have 30, you're trying to bring them in, the next day you have another 30.
The alarming rise in positive cases in Kano State also came up for mention, with the chairman of the Presidential Task Force disclosing that the situation was assessed and monitored. The NCDC is to send an enhanced support team to mobilize resources for contact tracing.
We'll be looking at...
Since the coronavirus outbreak in Nigeria in February 2020...
Well, you could see I didn't know where we were.
Yeah, like we said, the health workers they are the ones that are really exposed to this virus, you know, and it's just the government has to find a way to protect them for us, you know. Just like we said, this is a war, and in every war situation, everything has to be on the ground to protect people, especially those who are at the front line.
You know, again using this whole analogy of war and soldiers, a soldier has to be properly equipped.
Exactly.
You can't send a soldier to the war front
and you don't
without
equip them properly.
The professional kit.
Yes.
Kit. And unfortunately, there have been complaints here and there that people are, continuing the heroic work, not necessarily having all that they need to do so. The result has been that the people who are supposed to be taking care are ending up themselves needing care. And as we were hearing there, this is hardly a situation that we can afford to have soldiers, taking off active duty, talking about health workers now, taking off active duty in order that they should be cared for. And we said here from time to time, the last thing we want is for us to be overwhelmed by this corona fight and situation. We're waiting to hear who we should be talking with, but in the meantime, we'll continue here.
Yes. I think at some point we will be overwhelmed. So we shouldn't think that it's just going to be rosy. Across the world, they are also overwhelmed because there are some countries, or most countries, are already overwhelmed with not having the kits, the personal protective equipment, for the health workers. And that is where we are also having the challenge, because if the health workers don't have these kits, the first person that comes in contact with any patient is always the health worker. It's either then, like in Kano, for instance, those who tested positive were as low as the cleaner. Even the medical officer who takes care of the register was also infected. So it's not only the doctors or the nurses, everybody that is involved in medical care, has to be protected in one way or the other.
Let's find out, from the person who actually knows a lot about this whole matter. I'm talking about Dr. Japhet Olugbogi. Dr. Japhet Olugbogi is he's like the coordinator, since different, spheres will have different coordinators. He's like the coordinator of the Lagos sector, I'll put it like that, as far as the NMA is concerned. He is also chairman of the Committee on COVID-19. COVID-19.
Like the task force.
Yes, thank you very much. Thank you very much, Dr. Japhet Olugbogi, for joining us.
Good morning. Thank you for having me.
Indeed. Tell us how serious the situation is. And we're talking about health workers, those on the front line of this struggle against COVID-19 being properly equipped. First of all, would you agree that they don't always have all they need in terms of PPE, and how serious is it?
Yes, thank you very much for having me once again. I agree that they don't have enough PPE, and we are not talking about the public health practitioners alone. I mean, we are not talking about the public medical practitioners alone. We are also talking about the private medical practitioners as well. The government that said that we don't manufacture these PPEs in Nigeria, and they are hard to come by. And then maybe as a result of that, there's no enough population, and the government needs to provide adequate PPEs for all health workers. Like you rightly mentioned, we cannot afford to allow our health workers come down with this virus, because research has shown that health workers are the ones that can spread the virus far more easily and far more reaching than even the populace to the teeming health workers around them, and to their teeming patients as well. They can also go back home and spread the virus to their family members. So health workers need to be provided with PPEs, adequate PPEs for them to protect themselves. And we are talking about everybody that works in the hospital, not just doctors and nurses alone. Because for instance, if you have a cleaner who is not well protected, who has access to the clothing materials from patients who are positive for the virus, these cleaners will have to clean the whole facility, all parts. He or she has access to all parts of the facility. So you see, they can transfer germs or the virus itself from one part of the facility to the other, from table to table, from one equipment to the other. So all health workers have to be provided with adequate PPEs so that they can protect themselves, just like we have body armor for soldiers, just like we have helmets and boots for soldiers. So our PPEs are very vital for our health workers.
You know, Doctor, this question, you being a man of science, I know you won't want to generalize, but I'm trying to get a sense of how serious the situation is. Is it your estimation, and this is where my referring to you as a man of science comes into it, is it your estimation that we are 10% in deficit or up to 25%? I mean, what would you like to see? I'm trying to get a sense of how serious the deficit is.
Yes, thank you very much. It is very serious, especially here in Lagos, and I'm sure if it is in Lagos, it's also very serious in other parts of the country. We have a number of health workers that have contracted the virus right now. As at 2 days ago, when we have data keeps coming in on the hour and every hour. So I don't have an update right now. But as at the last count, we have at least 300 health workers who had been positive for the infection. Doctors, nurses, lab workers, people who are doing surveillance, people who even some members of the emergency operations center as well have contracted the virus. So the case of health workers being protected or not being protected or contracting the virus is actually very, very serious. And there is fear in the medical community, and the NMA is urging everyone to protect themselves. They are also urging the government to provide adequate PPEs for health workers to protect themselves. We're also urging the CMDs and MDs of hospitals to source for PPEs to protect themselves.
Okay, Dr. Olugbogi, I'm going to have to interrupt you for a while, but please stay with us. We'll be right back. Okay, welcome back, and we have Dr. Japhet Olugbogi with us. He's chairman of the Committee on COVID-19 for the Nigerian Medical Association Lagos branch. Thank you very much, Dr. Olugbogi, for staying with us. Just before we went on break there, you were using the number 300 medical people themselves haven't become COVID cases. Well, my colleague here, Asukwa James, has a question for you.
Yeah, because you mentioned 300, I just wanted to know, did you say 300 health workers in Lagos or in Nigeria are actually tested positive for COVID-19?
In Nigeria, over 1,000 are already exposed, and over 300 have already tested positive for the virus. So we need to be wary of this and protect health workers. We know whether you provide PPEs for health workers or not, because of the way we are trained, health workers will still want to work. They also want to, honor the code it's working. But then again, you need to protect them and protect their family members, protect their colleagues.
Okay, it's frozen for a while, but it's going to unfreeze itself soon. So, a bit worrying. As he explained that figure, because it was alarming, 300.
Because they said 1,000
are actually those that have been
exposed.
Exposed, but
that's the whole Nigeria, 1,000
exposed. But 300 have actually become cases themselves. We will need a bit more clarification on that, because I suppose when we use the word exposed in the kind of way that medical people will use it, it's when your equipment, your PPE, personal protective equipment, is either not available or not working, or you don't have a full battle suit, that kind of a thing. Maybe that's what he means by yes. It seems logical.
Yes.
That might be what he means by exposed. But for the love of God, but 300 have actually become cases themselves. Do we have Dr. Olubogi back online? Dr. Olubogi?
I'm here.
Okay.
I'm here with you.
You heard us just talking in studio. Were we getting it right? That you are saying that pan-Nigeria, we got about 1,000 health workers, as far as NMA knows, that are exposed, but that 300 of them have become COVID-19 cases themselves. Did we get you right there?
Over 300 are exposed. Over 300 are exposed. We don't know for sure how many people have tested positive. And the reason being that we have samples that are yet to be run over a number of days now. So we really can't tell. We don't have the exact figure of the number of people that have tested positive. But we are sure, as of 2 days ago, that over 300 people have been exposed to it. And we know that even far more will have been exposed to this virus all over the country. Even far more, because we don't have enough data as we speak.
Okay, you complained about non-availability of PPE. So what kind of protective gears are the medical workers, using at this moment?
Yes, each unit, each hospital is expected to source for PPEs for their teaming workers. But then again, it also behoves on the government to provide these hospitals and these facilities with PPEs. And when we are talking about PPEs, we are not talking about the suit alone. We're not talking about the Hamza suit alone. We're also talking about caps, goggles. We're talking about face masks, whether surgical face mask or the N95. We're also talking about gloves for the teaming workers, and then aprons where required. All these gadgets that I just mentioned, attempt PPE in the wholesomeness. So we have a shortage of these items in far many facilities right now, and not just in Lagos, all over the country. And if you have a health worker that wants to work, that wants to attend to a patient and does not have a face mask or does not have enough face mask, their morale will be down. You need to keep the morale of the health workers up right now so that they can discharge their duties without any hindrances or without any fear or favor.
Excellent, Dr. Olubogi, that you touched on the point that you just did as you were closing. Because I was wanting to bring up the matter of the physical health of our health workers. You've just been explaining how that is all important. I wanted you to talk to us about the mental health requirements as well. This is a pandemic. Doctors are working around the clock, I imagine. It's a situation no doctor has really experienced before. No, not very few. No doctor has experienced before where there's a constant demand on them. In addition to protecting them physically, is there a need, do you think, to also take care of them mentally as best we can so as to prevent post-traumatic stress disorders?
Yes, absolutely. Like you mentioned, it's a novel situation that we found ourselves. And each time any doctor goes out to the field or to the facility to work, that fear that they may come back with the virus always there. And then I know, especially for those who have a family, one family or the other, it's a rife fear amidst them. Nobody wants to put it in and take it back to their family at home. So, like you rightly mentioned, yes, doctors or health workers should also be given some form of mental support. And mental support, not only them talking to psychiatrists or psychologists. When somebody goes to work and is sure that is insured, whether in terms of injuries or in terms of mortality, that is death. They have life insurance. They have injury, some form of insurance for injuries. At least they will be at least better motivated to want to put in their best. They will be better motivated to want to go out of the house in the morning to go to their various places of work. Also, when they know that at the end of the month or at the end of the day, they come back with something in their pocket or in their account, they know that I'm talking in terms of some form of hazard allowance to at least to cater for them. They know, they are reassured that at least the effort they are putting in is not in vain. So all this needs to be put together and given to the health workers so that they will be reassured mentally and not just physically. Physically, we're talking in terms of PPEs. Mentally, they should be incentivized as much as possible.
Talking about incentivization, government has actually done something. What would be your impression? I just put it like that, done something. I imagine that if they could, they'd like to match what is going on elsewhere around the world. But give me your impressions on the, incentivization by government.
Yes, government has actually done something, but what government did is to pay hazard allowance for a month. That's for the month of April. They increased the hazard allowance to 25,000 for Lagos health workers, which is laudable in itself. But we will expect that this hazard allowance be increased even far more than 25,000 naira. At least the minimum that we are looking at from NMA perspective should be at least 50,000 naira. And should be paid according to your grade level. It should be spread according to your grade level, according to your basic salary. And then apart from that, it should not stop at month of April alone. Why would somebody collect other allowance for the month of April alone? I mean, even if you are talking about the coronavirus pandemic, this virus came into Nigeria since February. So why would they be paid other allowance for April alone? We have February there, we have March there, we have April there, and it's not even stopping in April. We are still dealing with the pandemic. In fact, we are just starting our response in Nigeria. We're just starting our response in Lagos. The outbreak per se is actually just starting. So government should look beyond April to pay other allowance. The other allowance should come and stay. It should not just be a one-off thing, and then it should be spread to all health workers.
So have you made a case for the increment of the hazard allowance and for it to be a permanent thing, at least for now that the pandemic is?
I didn't get that, please.
I said, have you made a case for your members, for the hazard allowance to be increased and for it to be permanent?
Yes, of course. The NMA National has engaged the federal government and they signed some form of agreement, and we are hoping that they will honor the agreement. Apart from that, NMA Lagos, led by Dr. Saliu Hosseini and his hard-working team of officers committee, have also engaged the government on a number of times. They have released press conferences, they have met with government representatives, and they have made their position clear that this hazard allowance, even before it was paid, I think it was all those interventions that actually yielded the government paying the hazard allowance month of April. But they have made it clear to the government that no, this hazard allowance should continue, it should not be restricted to the month of April alone. Health workers are not faced with hazard only in the month of April. They are faced with hazard all round the year. So the hazard allowance should continue, and that is the position of the Nigerian Medical Association, and they have made it known to the government, and they are still making efforts to make it known to the government, pressure the government into yielding that demand.
All right. I'd like to thank you very much, Dr. Jafet Olubogi, Chair of the Committee on COVID-19 for the Nigeria Medical Association Lagos branch, for coming on and sharing your perspectives. You all are heroes. I'm sure every Nigerian thinks of it like that. And we do pray that you continue to be safe as you go about this indispensable work that you are doing. Okay, we're going to break. Stay with us, please. We'll be right back. We still have our public health expert, Dr. Madili Boyo, to speak with. Okay, welcome back, and that was quite informative there with Dr. Jafet Olubogi. We also have Dr. Madili Boyo. Is a public, well, actually, we're working on him. In fact, I hear that we do have Dr. Madili Boyo. Good morning, sir. Thank you very much, as always, for joining with us.
Good morning, Mr. Yori.
Thank you very much for coming on. You probably were listening to your colleague there, Dr. Olubogi, and our concern this morning is the health workers out there, the analogy of our soldiers on the very, very first line of defense. They are, as in every country that is battling this pandemic, our heroes. But then they need to keep our heroes as well equipped as we can and as safe as we can is the subject there. Weigh in on the matter, if you will. What would be your perspective? Because I know that, first of all, you're going to be totally for that. But are we doing all that we can? Because no government in its right senses would want to do any less than the utmost that it can.
Yes, I agree with you. The problem we are facing. Hello?
We can hear you. We can hear you.
All right. The problem we are facing is that I don't think the government sees this as a war, even though it says it. And it doesn't see the doctors and the nurses, the lab scientists and the hospital workers as a frontline soldiers in this war. And if it does, then it's unfortunate that the level of preparedness of the hospitals have been very, very low. What we see every day is the NCDC, the Center for Disease Control, managing COVID-19 patients, and then we just don't know what's going on in general hospital, the preparedness of the teaching hospital, the preparedness of the private hospitals as supporting structures. Because even though we hear over and over again that private hospitals will not treat COVID-19, the problem of asymptomatic carriers will really make private hospitals be in a very difficult situation where they have to be at alert. Every case is a suspect. And then how ready are we in the private sector? How ready are we in the public sector? The other doctor from NMA did say about PPEs. You can't believe it. In this country today, you can't get a glove to buy at the rate it was going for before. You can't get the masks, the surgical masks, the N95 masks. The government should put in effort in making sure that these things are heavily subsidized. If not for free.
Well, Dr. Boyo, you probably heard the other day that government had taken away the duties on all medical equipment coming in.
Come again, sir.
There was the news item, I think, earlier this week that government had lifted duty on all forms of medical equipment coming in to help fight this scourge.
Yes, but you see, we always come late in everything we do. This thing has been on the front burner since February, and every part of the world knew it was going to be a pandemic one day. One would have thought that the first thing we do is to start manufacturing face masks in this country. We start manufacturing face masks in this country. So it should be so cheap that every hospital can afford it. And the government should be shipping face masks to hospitals and to private hospitals. It should be available everywhere. This is the least government can do, the personal protective equipment, PPE. That's the least it can do. I'm not talking about money. We're not talking about extra money yet. Let the frontline doctors be safe. Let the environment be conducive. Let it be safe for them to practice, or else they will die. And when they die, there'll be nobody else to take care of you and I. So I agree with you, yes, that Ghana has started, but why do you come second every time? We are far more advanced than Ghana in many ways. We are more populous, we are richer than Ghana. So why do you come? Why do you always play second fiddle?
And
we knew this thing was coming. Yes.
And the kind of equipment you're talking about, where especially when you're talking about face masks, is not what we people have been asked to wear. Not the cotton face masks. These are special ones for people who actually come in contact with known cases of COVID-19, and these are not to be found anywhere, and these are not cheap. When you said we should have started to manufacture, do we have the capability?
Mm-hmm. They are cheap, sir. They are cheap. Before you could get 50 face masks for 400 naira.
No, sir. I'm talking about the ones that they say are the proper ones for people who are coming in known contact. In contact with known cases. They say those ones are what, N95? Is that the correct terminology? That these are not to be found anywhere. It's frozen again, but as soon as it unfreezes, he'll let us know.
Yes, yes. I'm not talking about even the N95, Mr. Yori. I'm talking about simple surgical masks.
Oh, okay.
They were going for 400 naira.
Okay.
You can go on, sir.
Hello?
Please continue. Yes, we can hear you.
We were going for 400 naira a pack before.
Yeah.
A simple surgical mask.
Yeah.
We're going for 400 naira a pack. They're going for like thousands now. People are profiteering, and we are saying that if government brings down this, it can be manufactured. The thing is so easy to do. I mean, it's not today we'll have been doing this, and that's what we're always caught napping. We ought to know, even from the time of Ebola, that we should be producing these things locally. Face masks of maybe simple surgical face masks.
Yeah.
Simple surgical face masks, like this, like this.
Yes.
Like this one.
Okay.
This one.
Yeah.
This one.
Yes.
Yes. This one should be produced locally. It's not what is there in it. By the time we had Ebola, when we're threatened as a country, this thing should have been produced, to be produced locally. Now, you ask me how will we do it? That's left for government to do. And if we produce this locally, we will supply the whole of Africa. We're not talking about N95. If every hospital can have this, just like that, even at giveaway prices, it's good. Then you're not talking of the N95. N95 is expensive because although we use them now, we're using N95 for 2 days, 3 days. It should be one go. Use it, drop it after work. So what we are saying is that the PPEs, the personal protective equipment for doctors, for nurses, it's not doctors that wear this thing alone. In every hospital where you have 5 doctors, you have like 25 nurses. Now, all nurses, all doctors, laboratory scientists, radiologists, anybody that's working in the hospital environment must wear this.
How about latex gloves? Because Dr. Boyo, how about latex gloves? I think it's part of it. You were talking about profiteering. These things have now gone astronomically high vis-a-vis the price they were before. Just yesterday, I asked in a chemist how much a pack of latex gloves cost, and I was told 4,500 naira. You know.
I didn't get you well, sir.
I said you were talking about profiteering in these basic equipment that we see. Yesterday, I was saying that when I was talking about latex gloves, I asked in a chemist for, do you have a pack of latex gloves? They said yes, they did, and it cost 4,500 naira. I believe that's multiple times what it used to cost before.
Oh yes, multiple times, and that's because we're never ready. You see, they said to be forewarned is to be forearmed. This is a cycle of events. Almost every 10 years, we have major pandemics all over the world, viruses in particular, like the Ebola. We never seem to learn the lesson from the last war. Now we have a situation where we start doing last-minute preparation, importing from here. Even America, big country like that, couldn't cope. But they can produce this thing. We should learn and have, like how we have the silos where we store rice, we have silos for storing beans. We should have stockpiles of some basic medical equipment for times like this.
Okay. Can we manufacture any of this at all? You said that we can easily manufacture those face masks. Can we manufacture latex gloves? I mean, I'm thinking of very, very, very first level of equipment. But while you're composing the answer, let me also let Yakub who has called in from Ifo, come on the line. I'll come back to you, on that, Dr. Boyo. Good morning, Mr. Yakub.
Yeah, Chief thank you very much. I'm very happy that I got in this time around. Chief I think Nigeria is not yet to
you beat Maz into it.
Even from the Ebola period, when we defeat Ebola, I think by now we could have not been talking about producing just ordinary fake masks by now. But I want to relate this question to another one so that Dr. Boyo on the other side can be able to provide a very good and valid answer, including Asuko in the studio. Because I want to say this, Chivalry. We are just talking about fake masks now. What tells us that even Nigerian citizens that producing these fake masks, what tells us that Nigerian government will adopt it and beginning to use it or beginning to distribute it to hospitals? Why am I saying that? Chivalry, today, day before yesterday, if I'm correct, I Googled Madagascar, Chivalry. I found out that in that very particular country, they have never recorded any death, and then they are using this herbal product. Chivalry, my question to Dr. Boyo on the other side is that why is it Nigeria is so skeptical and then they were not believing African thing? What are we doing?
Okay, Yakub, thank you very much. I got you, and I got to free up the lines. Thank you very much, Yakub. Dr. Boyo also heard, in particular, you went to Madagascar, where they've come up with a tonic that the World Health Organization has cautioned about, but as you wanted, let me let Dr. Boyo, relate to the question.
Yes. I've read of that, though not in peer-reviewed journals. I've read of that on various social media channels, and then on the news, that Madagascar has gone far in producing this. The question is this, that things that have to do with herbs and traditional treatment, we still have issues with dosage, side effects, and clinical trials. We don't know how far they've gone in Madagascar in clinical trials, because if you discover a drug, before you give it to the public to take, we have to know how many people you have treated with it, what were the side effects, and then you have COVID-19 people with diabetes, can they take it? COVID-19 with heart failure, COVID-19 with liver failure, COVID-19 with kidney failure, COVID-19 children, COVID-19 adults. So at the end of the day, while we'll appreciate the extent they've gone in this discovery, it has to be subjected to clinical trial. What do I mean? Some people, double-blind studies, where some people with the disease, some without the disease, some with light, very mild symptoms. So we have to know the response of people with this disease to the drug. And at what time do you give it to the person? Is it as a preventive drug? Is it after the disease has started? Is it when the disease is at an advanced stage? Is there a time when it can be more deleterious, more dangerous?
So all of this that you're saying, Doctor, all of this conform to best practices in the medical community.
That we should wait to see.
Okay. Asuko wanted to.
No, but Doc, you said this is a war. This is a war situation. And out there, people are saying if it's a war situation and we see it as a war situation, everything should be thrown into the battlefield to see that we deal with it.
Okay, but even as you've asked that question, please hold your thoughts, Dr. Boyo. A call is coming from Ibafo. Tolu Alokwe in Ibafo, Ogun State. Good morning, sir.
Good morning, Uncle Yori.
Oh, it's a ma'am. Good morning.
I'm so happy to get through to you today.
Thank you very much.
Just about what Mr. Yakub just said.
Okay.
I want to tell that line.
The Madagascar tonic.
I don't really know why we are getting inferior of ourselves. just when this pandemic started, we had of a governor mentioning some of our herbs. That's what he used.
Yes.
I don't want to mention the governor.
The Bauchi State governor.
No.
And there's also the Oyo State governor who talk about black seed oil.
He used our medical herbs. He didn't mention anything about foreign. If we are talking about the measurements and the whatever we need to use, why don't we sit down and look at what measurements we need to use? We are always following the Western world. Talking about this face mask, we have seen so many of these things being made by people that people are wearing, even those ones that are very good at night, that really cover everywhere. Even beds, we have so many people that can do all these things, but we like to push our money to them to get the Western world richer.
Okay, okay, ma'am. Let me bring Dr. Boyo in on it. Thank you very, very much for calling in. We do indeed. We're happy as well that you were able to get in today. Dr. Boyo, Madam Tolulokwe there, no doubt was referring to. Do we have a case of inferiority complex sometimes that when we develop it, then we begin to look down our nose, especially allopathic doctors like your good self, when relating to alternative medicine practitioners?
All right, very good. We don't have any inferiority complex because like your colleague said, when there's a war situation, use anything that we can use. But as orthodox doctors, we are trained to weigh side effects. The Hippocratic Oath tells us that we should not commit more harm. A patient is already having an issue. We should not complicate the patient's problem. So I agree with him that we are looking inwards. If the drug is being tested in Madagascar and is good enough, let's see the journals. Let's see the people they've used the drug on. Because we can't just start as doctors and say we want to collect the drug. What's the dosage? At what level does this drug become does it develop complications or side effects? At what level? So I agree entirely that we need to look inwards, but because it's a war situation, doesn't mean you cause more harm.
Okay, I hear you, Dr. Boyo, but as you know, you know better than I do, in Lagos State, they are taking alternative medicine perhaps a bit more vigorously or seriously than other areas where they have a whole council and points that have been raised by allopathic doctors, aka orthodox doctors. These are fully addressed, dosage and all those kind of things. Maybe clinical trials, because I know that scientists require rigorous tests and that kind of a thing. They want to exclude all possibilities of guesswork, but that takes for ages and people are dying. And they seem to be recording successes. But Mr. George in Ikeja has come on the line. Good morning, sir.
Good morning, Uncle Yori.
Thank you for calling in.
And greetings to Asuko.
Good morning.
Uncle Yori, when the president announced the other time that there was an insurance scheme for medical practitioners on the front line, I was very happy about it. But listening to the doctor you interviewed first, it appears the implementation has some hiccups. Why paying for only April when the thing started in February? I think someone in the presidency needs to step in there to ensure that people who are in this dangerous work are not shortchanged. Money may have been budgeted, but to reach the people that it is meant for will be another. You know what corruption is in our country. Secondly, on Koyori, I have been wanting to raise this issue of implementation. I'm surprised that the police or the IG of police is not included in the briefings they usually have every day to discuss the security aspect of its implementation. There are challenges about implementing this lockdown and the regulation everywhere in the country. Why is the police not involved in those briefings to give Nigerians the security report about the implementation?
All right, then. Thank you very much, Mr. George. I've got to interrupt there, so that we can manage the time. Thank you very much for that point. In fact, you started another stream, as it were. But going back to Tolulokwe's issue, I think Dr. Boyo was on that. And I had brought up the matter that the attitude of the medical community, or shall I say, the health community in Lagos State. They have a board, a council. You know all about it, Dr. Boyo.
Yeah. Yes, I know about it.
So correct me if I'm wrong. I got the impression that these that council, board, whatever it is, that body.
We also have pharmacists.
They also have their own pharmacies and things like dosage that the doctors, allopathic doctors, Western, you know what I'm orthodox doctors that they are very concerned about. They would appear to have addressed it, and indeed, there are members of the councils, if it is a council, that actually are allopathic doctors as well as alternative practitioner doctors.
Yeah. Hello?
Yes, we can hear you, Dr. Boyo.
Yes. The issue we are facing here is that the monitoring of orthodox doctors is not the same thing with the monitoring and the legal implication of whatever you do as our traditional health practitioners. Like now, if you take Agbo and it's prescribed to you and you die, if a doctor gives you a drug and you die, they are two different things entirely. So doctors are more heavily scrutinized. They are more heavily sanctioned. Even advertisement on radio and television, if you listen very well, you hear all kinds of things being said in the buses, being said on air by, Baba Onishegun, father of 1 million children. You can't do that as a doctor. You'll be sued. You'll be called upon by the Medical and Dental Council.
Yes.
So we're not under the same regulatory authorities.
Okay,
That's
one moment, Dr. Boyo. Thank you very much for, that response. I know it wasn't as full as you would have wanted it. Ade has called in from Ibadan, I believe. Good morning. Ade in Ibadan.
Good morning. Good morning.
Thank you for calling in.
Okay. Thank you very much for the good work you're doing. I just want to raise the issue about the personal protective equipment.
Sure.
I agree that it's very important for the health workers, but I also think that health workers too have to take extra precaution, because it is not everybody in the hospital environment that may be attending to a COVID-19 patient. So extra precautions too on the part of the healthcare workers is necessary. I know why I'm saying this, because I've also seen a few lapses. And I think we should also think about that.
Okay. Thank you very much for phoning in, Ade from Ibadan. I'm making that point.
Yeah.
But also, COVID-19 cases are not treated in the general hospital environment.
But it depends. It depends on the symptoms that the person will be taken to the general hospital. And it doesn't. It won't show, or it won't come out and say, "Oh, I'm COVID," but you will develop that symptom.
Okay, Dr. Boyo, you heard what Ade in Ibadan said. Your comments, please. Dr. Boyo, did you hear?
Yes, I'm here.
Did you hear the contribution of Ade calling in from Ibadan?
Yes, I heard
okay.
about health workers taking precaution.
Yes.
Yes, she said that even health workers that are not directly attending to COVID-19 cases could be at risk as well.
Yes. In fact, now in medical practice you suspect everybody. So there's what we call dual mode of suspicion. The patients are suspicious of hospitals, that they may go there and catch the virus, as you say in Nigeria. The doctors are also suspicious of even a pregnant woman coming in. Is she positive? So there's a mutual suspicion that puts the burden on the health worker to be extraordinarily concerned in terms of being totally protected. So when you come to the hospital now, you see a doctor wearing a mask, nurses wearing masks, even the security man wearing masks, everybody wearing masks, and then the patient comes in. So we have what they call triaging, where the patient is kept outside first, take the story, take the temperature, take the blood pressure, before we now allow the patient to even enter into the hospital facility. So there's a comfortable place outside where we, as it were, discriminate. So we pick up people that don't have symptoms that could be confused with COVID-19. So what I'm saying now is that in those centers where the traditional medical people are working together with the orthodox doctors. There's collaboration, I guess.
All right then. Dr. Boyo, I want to bring in our last caller, and we're going to have to go all the way over to Arochukwu for that, where there's only one person that we know on TM, Mazi Okoroafo.
Good morning, sir. Honestly speaking,
good morning, Mazi.
Nigeria, we have also, Nigeria should go Madagascar pattern, because even the vaccine they say they are discovering, all of them are half roots. So there's nothing like any experts know that all these drugs they are all half. Nigeria should go down to traditional medicine now on ever. Whether just bomoru, then garlic, ginger, avocado, pear, lemon, we should use them now. Because what we have in Nigeria today is Nigeria we feel too big because they call us giant of Africa. Anything we see producing in this African continent, we neglect it. We should bring in Madagascar pattern now. What Obama should not be deceiving us every day. Honestly, local half.
Okay, Mazi, I got to let go of you now. Unfortunately, it pains me to do so, but I got the point that you made. And indeed, it is Azukwo's point as well that put everything on the table in this kind of an emergency, right?
Yeah, exactly. Let's save ourselves the stress of saying we want to, take our foreign exchange back outside, when we know that we have doctors, we have traditional medicine and everything.
Yes.
Let's just put it down. Then from there, we'll know the one that can cure and the one that we can make vaccines from.
So we got to thank, we would be remiss if we didn't thank Dr. Madele Boyo, our public health expert and social commentator that's been with us. Thank you very much, as always, Dr. Boyo, for joining our program today.
Thank you.
Indeed.
Thank you.
So that's our program today. Please be safe over the weekend. Azukwo and I, it might be also, who else? Two of you do this thing. If it's not you, then it's going to be our research guy.
Yeah.
Thank you. We just keep safe and join us on Monday.
And wear masks, face mask.
Indeed. And of course, wear masks. Keep on washing your hands and just do everything that you can to stay safe. Bye-bye for now.